The news of President Trump, First Lady, and close aide testing positive for COVID-19 now brings up a big issue of contact tracing after his campaign hosted numerous events with large crowds. More recently, the debate. So to sort through those big questions, we have this morning joining us Dr. Rossana Rosa, an infectious disease expert in Des Moines. Thank you again so much for being here. Not knowing when the president and others were possibly exposed and infected, how do we begin to wrap our heads around how many people he and his team have come into contact with over the past several days?
Good morning. Yeah, so there's a few ways to go about making decisions as to who needs to be, who will be contacted and who would be actually recommended to quarantine. So one of the ways in which you can do contact tracing is actually by, taking a history from from a case that you have identified. And essentially try to jog their memory, try them to recreate their last few days and determine who they have been in close contact with, and so that you can, in order to determine who would have had what we would call a high risk exposure, right? Which is still, according to the CDC's definition, is anyone who has been within 6 feet of contact and for at least 15 minutes or more.
We know Hope Hicks, the president's aide, was the first public case that we learned about. Do you think it is likely that contact tracers will be able to find out where exactly the president got that virus and from whom?
Again, it really depends on the contact, right? If he has I'm sure he has a very tight schedule, and who comes in contact with him is very closely held. So you might be able to more easily identify that exposure. The farther you go out in their circle, then perhaps it becomes much more difficult to say, who was the person that initially, his aide contracted this from, and who were they in contact with? And so perhaps the farther away you go in terms of his circle, that's when it might become a little bit harder to determine where that infection actually occurred.
Good news, we're hearing everybody's doing well. The First Lady tweeting that out. How do you think the White House doctor and his team are treating the President and First Lady right now? Are there mitigation measures that you're aware of, or is this mostly just a monitoring situation?
Yeah, so in terms of the health of the President and the First Lady, what we know about the coronavirus is that, again, about 20% of the infections can actually be asymptomatic. So it could be that they will never even go on to develop any symptoms, and one would hope that that will be the case. However, so there's different ways in which the virus can progress. Again, so for some people, no symptoms at all. For some people, very mild disease. However, and that mild disease usually happens during the first few days after the exposure, the initial, what we call the viral phase, those first 7 days. However, for some people, it is actually in the second week after infection, so after day 7 into day 10, when they can go on to develop a severe inflammatory response, which is what ultimately can land people in the hospital and for them to require, oxygen support and sometimes even mechanical ventilation. So it's really good that we hear that they are doing okay right now, but it's actually a day-by-day scenario. I'm assuming that something that the White House doctors will be doing is constantly checking their oxygen levels to assure that they are maintaining good oxygenation levels, and really asking about the symptoms that they are feeling. But it's not only this week. It's probably for the next couple of weeks that we're going to have to keep an eye on how they are doing.
Indeed, we know the president at the age of 74 is in that higher risk category, so something we will be anxiously following every day. Dr. Rossana Rosa, thank you so much for making time for us today.
Thank you for having me. Have a good day.